I know you know about the classification of pneumonia. You hear community acquired, hospital acquired, aspiration pneumonia, and then pneumonia and the immunocompromised. So to remember this, I use CHAI, like chai, CHAI, chai. So C for community acquired, H for hospital acquired, A for aspiration pneumonia, and I for immunocompromised. So for the community acquired, I like to put the anatomical classification under community acquired. Okay, so I put it under that. So let's move and see. So for community acquired pneumonia, usually if a patient comes to you in the hospital, okay, spend some days within the hospital. If the person came to the hospital, did not have pneumonia, all right, and spent more than 2 days in the hospital and then develops pneumonia. So maybe on day three, you realize that no, this person has developed pneumonia. That means that the person had pneumonia from the hospital. Okay, so that one will be called sorry, that one will be called hospital acquired pneumonia. All right. But let's say the patient spent only 1 day in the hospital. All right. The person has pneumonia. It didn't come from the hospital. It came from the community. The person brought it. All right. So that's community acquired pneumonia, less than 2 days. All right. So under community acquired pneumonia, we can classify by anatomy. All right. So we've seen the anatomy of the lung. So if any lobe of the lung is involved, it's called a lobar pneumonia. All right. So if a whole lobe is involved, okay, so homogeneous consolidation of one or more lobes, whether or not there is pleural effusion, all right, pleural inflammation, then you have lobar pneumonia. Now, the second one is bronchopneumonia. So it is in the name, all right. So it is a patchy, the bronchioles are sort of all over the place, all right. So you have a patchy alveolar consolidation. So it's not homogeneous in one lobe, okay, like a lobar pneumonia. So let's look at an image of the lung, and then we can use that. You see, one lobe has to be inflamed, then you call it a lobar pneumonia. But when the inflammation is patchy around the bronchioles, then it's not smooth, like it's not a uniform thing like a lobar pneumonia. Then we call that a bronchopneumonia. All right. Then we also have what we call, so it is a patchy alveolar consolidation. It is an inflammation of the bronchi and the bronchioles. Then we have interstitial pneumonia. So you see around the alveolus, around the balloon, the sac, there is a space between the sac and then the blood vessel where the exchange, occurs. All right. So when that space gets scarred or fibrosed, all right, we call that interstitial pneumonia. Okay. So you can see that in interstitial lung disease. So if you have a small normal interstitium allowing for, this is also a fluid filled space, right? Allowing for the diffusion to occur. Now there's fibrosis and things. So it becomes more difficult for oxygen, carbon dioxide to diffuse in and out. All right. So that's interstitial pneumonia. So this is classification by anatomy. Now, still under community acquired, you can classify it according to the organisms that cause the pneumonia. Remember, pneumonia is an infection. Okay, so it's either caused by a bacteria, a virus, or a fungus. You see. So for bacterial, you can have aerobic bacteria. That means that they thrive in oxygen-rich environment, and it makes sense because your lung is filled up with oxygen. All right. So these are the gram-positive organisms that grow within the which thrive in pneumonia. All right. So you have strep pneumonia, group A beta hemolytic strep. All right. Gram negative H influenza, Moraxella catarrhalis. Right. So you need to know these organisms. These are the common things that you pick up from the community. All right. So these are, you need to know them. Then we have the atypicals. All right. They are not the typical classic pneumonia organisms. So we have Mycoplasma pneumoniae, Legionella, Chlamydophila, and Coxiella. All right. So you can keep that in your mind. Then you also have viral SARS-CoV-2, COVID, RSV, influenza, adenovirus, HSV, and CMV, cytomegalovirus. All right. So these are the viral causes of community acquired. So the person brought it from the community. Okay. Then we have fungal. Also not that common. We have histoplasmosis, aspergillosis, and pneumocystis, girovirus. All right. So this are the organisms. At least you need to know the bacterial ones, and you need to know some of all of these. All right.